And today I want to talk of the causes of nosebleeds. Some people have their nose bleeding when they blow onto a piece of tissue, or sometimes they actually wake up and they see drops of blood coming out. Sometimes they spit out in the morning and it's like blood drip from the back of their nose into their mouth. And you also just have situations where a lot of blood is coming out of the nose. All these are different forms of nosebleeds, and they have so many different things that can cause a nosebleed. But fortunately, about 75 to 80% of nosebleeds are absolutely harmless and are from simple things like the atmosphere being too dry. When you're in an air-conditioned room, or if you're abroad and in a room that you need a warmer, the air gets very dry, or you're in parts of Nigeria during the Hamatan when the air becomes very dry and harsh. So the linings of the nose, which are very thin and very easily dried out, become dry, they crack. And because the blood supply in the nose is very, very good, any little crack will cause bleeding, and then this bleeding may scare you. Also, things like picking the nose, that thing we do when we think nobody's watching us. You can actually cause some injuries to the nose and then cause some nosebleeds. Okay, other things like the use of things that you should not be putting into your nose can cause a nosebleed. I will not go further than that. But the things that people put in their noses that have no business being inside anybody's nose, anybody at all, they can cause a nosebleed. We also have the use of some drugs. Some drugs will cause you to be dehydrated. There's some drugs like used in the treatment of hypertension and all that may cause some degree of dehydration, and it could dry you out. There are other drugs that for various different reasons that cause dryness of the mucous membranes. That's all these membranes inside the mouth, the nose, the eyes. And if they cause enough dryness, they can cause you to have a nosebleed. Then accidents, of course, accidents occur. The commonest amongst children, children fighting, hitting each other, sportsmen, footballers, basketballers, all sorts of sports hitting each other, then car accidents, bicycle accidents, all sorts of accidents, falls from heights and all. You could hit your nose and have a nosebleed. Then there's some congenital things. And when I say congenital, that means you're born with it. You have abnormal blood vessels in the nose, and they could cause nosebleeds because these abnormal vessels are very tender. So they bleed from any little rubbing, scrubbing, or whatever of the nose. We also have things that could cause nosebleeds that could be dangerous. You could have growths in the nose that could cause a nosebleed, and they can be very, very serious. They can start off as just mild nosebleeds, and you think that, oh, no big deal. Okay, so you can have the mild causes, the harmful causes, but there's a whole range of things. So whichever one you have, even though I said 80% of them could be pretty harmless, and then before I forget, there are also some that are caused by doctors. We call those ones iatrogenic, which means maybe a doctor is trying to examine you, puts an instrument or does surgery on you, and after the surgery you start bleeding. That's another group of nosebleeds. But whichever nosebleed you have, if you have bleeds that last more than 10 minutes at a time, if you have bleeds that are just reoccurrent, please see an ENT surgeon and get it checked out so that nothing more serious is hiding in plain sight. Have a good day.